Hi everyone, I'm Sarah, foot health practitioner here at Physical Balance. Recently I've had a lot of clients come in for Verruca treatments, so I thought I'd just do a quick video on what they are and how we treat them. So verrucas and warts are the same thing. Verrucas are just named differently. They're actually called plantar warts because they're on the bottom of your foot, so the plantar area of your foot. They're caused by the HPV virus, but as we know from COVID, viruses have massively different strains, different parts to them, and they behave differently. Different strains behave differently, and they also behave differently with different people as well. So we always treat individuals with Verruca differently. So it all depends on how they look, how they behave, how you feel about them, as to what treatments that we can do. They generally look like a lump of hard skin. They can be painful. The pain may be because the skin builds up and it's that pressure that causes the pain, or they are just on an area where you're constantly walking on them and it's just irritating. So they have like a cauliflower type appearance to them. So the skin on the top is dry and it is a bit bobbly, and they can have some black dots in them as well. They don't always have black dots. They are not the roots of the verruca either. So if they are painful when you pinch them and you get a bit of a shooting nerve pain, then that's a verruca. If it hurts when you just press on them directly, that could be a corn, and that is just a build-up of hard skin, which we can also treat as well. So you can have just one, or you can have a cluster of them, or you can have one on your toe, one on your heel, one on the side of your foot, and you can also have just one on the other foot as well. They can spread. If you start picking at them, they can spread as well. They can get bigger, you can get a few more of them. If the toes are rubbing together, you might generally get one on another toe as well. And they can come up on your fingers and your hands as well, so be careful if you do pick them. We generally treat them because they're either painful or cosmetically not very nice to look at. So whichever way you want to treat them, we can have a look and see what options there are. So verrucas themselves sit within a layer of skin. So this is your skin, and it sits here in this pink layer here. So it's just below the very top, which is the skin, that dead skin that just kind of comes off all the time, and it is just above where all the veins, the capillaries and the nerve endings and things are as well. So they hide within this little area, so they can be quite difficult to get at. So here is a closer version of it, and so they're in these little cells. These cells start to break down and flatten out, and then that's when they come up the layer of skin. What they do is they hide within these cells, and they absorb a lot of the water that's within there. So that's why you get a lot of dry skin on the top, because they've just taken all the water from the top, and they swell up. And the little black dots that you see are the capillaries that have been squashed out of the way, and they just pinch together, squash up, and the black bits are the dried blood that are at the end of the capillaries. So evidence suggests that we can treat them. We can just leave them alone, and sometimes they just resolve on their own. We can do what I call a wet method. So we can put tape over it, a plaster over it, and just keep that nice and wet and mushy, and then the skin regenerates quicker. What we're essentially doing is tricking your body into thinking there's a wound there, so it needs to get everything in there to help repair that area, and hopefully push the verruca cells away, and get the immunity cells in there as well. The other one is the dry method. So surgical spirit on that area twice a day, that dries out all of everything there. So again, it is making a wound because it's very dry, so the skin will have to regenerate, get all the things nice and nutrients back in, and push it up. Over-the-counter treatments can work as well, depending on how long you've had the verruca. If you see it and start treating it straight away, then sometimes they can resolve very quickly. In clinic, I do a treatment called Verruca, which is an acid-based treatment, which is only available in clinic, and that is every 2 weeks. You come in, we take down all of the hard skin and put the acid on there, and then you put surgical spirit on every day in between those appointments, and hopefully within 6 treatments the verruca is gone. And so the last one is very exciting. I'll be doing the training for this at the end of June, is cryotherapy, which hasn't been done for a little while. I don't think we do it in clinic actually at the moment. So really exciting to be doing that. And that is, again, you freeze the area, creating a wound, destroying all the dead tissue, all the tissues around that, and hopefully the skin will regenerate and come out. If none of those work, then our podiatrist is able to do something called a swift treatment, which is microwave therapy, which is heat going in and destroying those cells and hopefully getting rid of the verruca that way. Or needling, which needs an anaesthetic, and I think that, I'm not quite sure what treatment that is, but I think that's just needles going in, and again, we're creating a wound. I hope that makes is nice and informative, and if you'd like any treatments or advice on a verruca, if you have a verruca, if we can treat it or what you can do about it, then give us a call in clinic, and I'll look forward to seeing you soon.